What if better health isn't just about facts, but about the stories we tell? We're a Sciana Health Leaders Group meeting in Salzburg, tackling one big question: how to influence population health through narrative. Today we're joined by Dr. Chris van Tulleken, NHS infectious diseases clinician and associate professor at University College London, whose work explores how corporate forces shape our health. You may know him from the BBC's groundbreaking documentaries and as the author of the bestseller, Ultra-Processed People. He's shown millions how food, policy, and persuasion collide, and how smarter storytelling can change behaviour without blame.
Thank you for your time. We're really, really grateful. We're on a programme which is amazing. It takes us to Salzburg and we meet with lots of European health leaders. The question that our group is looking at is how we influence population health using narrative. And obviously I've seen your work on the BBC and also your book. And we just wanted to ask you some questions about how you've approached that and kind of what drives you to actually undertake the work that you do with that population health lens in place.
I'll tell you the chronological story of the journey into the work that I'm now mainly doing and see what emerges from that. I'm an infectious diseases specialist, and as a young doctor, I worked in very low-income settings and had a sort of exposure to, I guess, what we would now call the commercial determinants of health. So things like ethical marketing of formula and ultra-processed food in very remote settings, particularly soft drinks and Coca-Cola. But didn't really, the problem was always dealing with the sick people. And then because I'm a broadcaster in the UK, I started maybe 15 years ago making programs for children and adults on the BBC. And those two careers were very separate in a way. I'd go on the BBC and say, I'm a doctor, and here's how you should live your life. And after maybe a decade of doing that and making programs like what's the right diet for you, or my brother made how to lose weight well, which was particularly horrible, how to stay young, lots of things on non-communicable disease. The narrative of the programs was always to assume that the viewer had an information deficit. So the working assumption was, if you only understood in enough detail about what to eat, you would eat that food and then your problems would be solved. You would lose weight, or your risk of cardiovascular metabolic disease would drop. And so we had lots of experts parsing in greater detail how everyone should behave. And programs always that rate the best are about food. I think because we all eat food, and because so many of us are struggling with food, so many people want to be a different weight than the way they are. So I made programs like this for a long time, and it became very clear that it wasn't working at all, that the problem was not that people didn't know this information. And I think that started to become clear in my clinical practice. You'd start telling patients, if you're a sort of young man and you start telling older women that they need to lose weight, you quite quickly realize they all know this. They've all tried multiple things, and your 10 minutes interaction with them is just shaming them and unpleasant. And I think I realized the television programs were doing kind of the same thing. So I was feeling uneasy about it. I was also making programs about the pharma industry, where there was a much clearer problem that the drug industry were excessively marketing drugs that didn't really work very well or were actually quite harmful. And so these three different parts of my life, where I was broadcasting about food and weight, broadcasting about pharma, and doing clinical work, all came together when I made a program about childhood obesity. And a young researcher gave me the Kevin Hall's paper on ultra-processed food and a paper by Carlos Montero. And at the beginning of that program, we'd set out to make a documentary that would basically say, childhood obesity is very, very complicated, and it's to do with urban planning, it's to do with inactivity, it's to do with fat and salt and sugar and marketing and all kinds of very complicated social and cultural factors and genetics and all the rest of it. And it became very clear that actually childhood obesity was a commerciogenic problem. It was driven really purely by commercial incentives. And that program was called What Are We Feeding Our Kids? And that was the first time I really engaged with the idea that obesity is primarily driven by industrial interests and financial incentives. It's really not population obesity. It's not driven by anything else. There have been adults who have lived with obesity since antiquity at a rate of low integer percentages, but more or less it's been unheard of. And so that program then led to a podcast about food addiction and my brother's own struggles with food. I have an identical twin brother who was living with significant obesity at the time, and I was treating him rather like I was treating the viewers of my programs or my patients, where I was, nagging him and telling him off and saying, you should really lose this weight, you should eat different food. And I think it was the podcast reckoned with his relationship with food and my relationship with him, and how I was shaming him and stigmatizing him, and how it really kind of wasn't his fault. He lived in Boston, he was very stressed. So I think there was a lot of stuff that came together. So when it came to writing the book, there was a television program, then there was a podcast. And then in the book, I wanted to try and convey the idea that it's not you, it's the food. All of us living with excess weight, it's not because we're all lazy, stupid people who don't understand food and nutrition science and can't add up calories. It's because our food is engineered to make us eat too much of it, because that's its purpose. And the science around ultra-processing, I think with the book I got extremely lucky that the public in the UK had heard just enough about ultra-processing that it was a hook. The British public had heard enough, they thought, yes, this seems to unlock something. There's something in this idea that instinctively and immediately seems explanatory. The book wanted to use that lens to see the food system and say to everyone, this really isn't your fault, it's the food. The difficulty I wanted to solve is that most books about food and weight and science are extremely boring. And people don't finish them. And I knew this because I tried to finish lots of these books and they're tough. So in the book, I think what I very consciously tried to do was there were 3 strands in the book, one of which was the science of ultra-processing and the policy piece, what the evidence tells us, which is that we need to regulate companies in a particular way and food products in a particular way. But no one's going to read a book about that. Even if they think they're interested, they just aren't going to finish a book on that. So the other 2 things in the book are my journey eating the food, which makes it more narrative. And then there is the possibility of the reader interacting with that journey. So right at the beginning, I say, this is not a book where I'm going to tell you to stop eating this food. I want you to eat it. I just want you to understand it. And understanding it may help you then stop eating it. So I really tried to make the book non-stigmatizing and inviting and participatory, and to tell a story about me and my own struggles, whilst at the same time being a rigorous science book. And whether I've done that successfully, I think people do seem to be able to finish the book. For me, big thing about the other aspect of narrative in the book is that there is a bad guy, and it isn't you. It's not you, the reader. You're not at fault. And a lot of self-help books, I think, trade on your guilt and whilst I'm slightly uncomfortable calling my book a self-help book, but at its heart, there is a little bit of that in there, because that's why people finish books. I think we're all quite selfish when we're reading non-fiction books. The other bit of narrative is how I position myself in the narrative. As a communicator, I've got a long aristocratic Dutch name. I'm a white man who is privately educated. I'm a doctor. In every respect, I am the last person that should be telling anyone what to eat. And so I'm very conscious around the book, around all of my, now I'm an academic who studies the food system. Everything I communicate, whether it's to you or to clinicians, to scientists, or to the public, my position is to be David to the industrial Goliath. And I never, ever tell people what to eat. And that's not always easy. I'm sure I have messed up and said something about it, but for a long time, I haven't done that. So that's also in the public discourse, I think quite hard about who I am and what messages people are willing to hear from me and what other voices we need to elevate into the space, because there are so many great voices who should talk about food and cookery and celebrate real food. But that's the other thing, and that's what I don't do, is I do not celebrate real food or traditional cooking. You look at my Instagram feed, there's nothing on me cooking, there's no recipes, and I'm not running a subscription diet service.
So one of the things we've been talking about in our group is if you step into that space where you start to promote, and one of the things we've been talking about a lot is vaccination, but if you step into that space in social media and things like that, you come across quite a lot of negativity, or you might get toxic responses and things like that. Have you experienced anything like that?
I experienced a lot of toxicity and negativity, primarily from academics who are funded by the food industry, because they're the people I name and I shame and I call them out. So I do get, even around ultra-processed food, despite being quite careful, that I do get comments from the public and from my colleagues that I am shaming people, that by saying ultra-processed food is unhealthy, I am shaming and stigmatizing those who depend on it. I get told that I'm taking away people's freedoms and they're sweet. So yeah, that does happen. I think there's no way of discussing food without that happening. But it does, I think it happens a lot less to me, maybe, than if I were to communicate in a different way or say different things. So it doesn't happen at a stressful level. And I think it's changed how I communicate around vaccines. You know, as an infection doctor, obviously I'm pretty committed to the idea of vaccines. And I make programs about vaccines for the BBC. I communicate around them as well. And I try and remember that most people who don't want to vaccinate their children, many of them are making other health decisions that are very sensible. So vaccine hesitancy often goes hand in hand with quite good beliefs around nutrition and health and outdoor activity and immunity and physical well-being, you know. So trying to understand what drives beliefs and be somewhat sympathetic to them, I think is more palatable. To me, I have a lot of colleagues who tweet with the hashtag vaccines work. I feel very uncomfortable about that because I also run a specialist clinic where I give people who are immunosuppressed vaccines, and some of them have quite severe side effects. We've seen people die from vaccines, from live vaccines in the UK in the last few years, including a colleague. You know, well evidenced publicized deaths from yellow fever vaccine. And we've just had a vaccine withdrawn because of side effects. So vaccines do work, but they also have side effects that are very real and they need to be well regulated. So yeah, communicating around things, I think as a public health authority, everyone has a sort of different voice. And if I were in government, I would communicate in different ways. Sometimes you need government to be more assertive. My expertise is how I do it and how I use my voice. Does that make sense?
Yeah. If you were advising the government, what would you be advising? I'm just trying to understand what you meant by that last bit.
Do you mean if I was advising the government about safe food or about vaccines?
If we say vaccines, how would you advise them to communicate differently? Because we're trying to work out what tools we could put together to influence in that space. We're just wondering, I just think that would be interesting to understand.
I think a lot of my communication around food was spent identifying the reason for the situation. In other words, the reason people are vaccine hesitant, I think, comes from two sources. One is a natural and possibly healthy suspicion of government and big pharma. And I don't say that in a conspiratorial way. You know, I have dear friends who work in pharma. I just mean the pharma industry does things that are harmful, and the history of vaccine development is constant. So part of it is just people kind of looking out for themselves. Part of it is extremely cynical. So there are a small community of people who I think just nakedly make money from positions they know are wrong. And there's a community of profiteers. RFK may be one of these people. So you've got to try to identify the enemies, as it were, one of which is a sort of cultural milieu. And those people are going to be swing voters. So you have to really clamp down on pharma bad behavior and ensure that you regulate everything extremely stringently and create trust with the public around that regulatory process and acknowledge where the public beliefs are coming from. But then you also need to police very tightly the misinformation and position yourself as trusted. One of the difficulties in the UK is that the government did not have spokespeople during the pandemic. So the government had the wrong messengers, in my opinion. They had people like me broadly. They didn't engage as much as they should have with people who looked like the people that really were hesitating about vaccines. And they were extremely enthusiastic about rushing things out in a way that let people be like, yeah, so it's just like a long answer. So I don't have an oven ready, here's how you communicate about vaccines. It's more like the approach that you take is going to be crucial, and it's going to be about understanding why people have the beliefs they do. Similarly about food, perhaps one really important aspect of communication is to get the commercial interests out of the room. And particularly around food at the moment, the Government Food Policy Committee is extremely conflicted. It's a committee that's co-run by the food industry. And I think that's going to be really hard for a whole bunch of people to really kind of listen to those messages. What we see with food is people don't trust government advice if it's been co-developed with industry. There is a broad mistrust of government advice. Then they go to social media where charismatic people or people in their own communities give them what feel like tailored solutions to their individual problems. We're very independent and accurate, but it's also. So government has to be much more clever about working with the communicators or different communities. The message there is all important. The right message from the wrong person is completely pointless. Does that make sense?
Yeah, I mean, certainly when you talk about vaccination, our course leader is David Behan, who's the chair at King's. He's really challenged us that we're speaking to academics and experts and not, you know, people from the Afro-Caribbean community to understand more. So I think there's something from that perspective when you speak about that makes sense to me.
I'll give you a quick example. A patient of mine from Angola was on the ward during COVID, had very severe COVID, and she had a hemiparesis. And we said that we really want you to be vaccinated. It finally came out that she believed that her paralysis had been caused by a vaccine. And everyone, you know, I remember the ward team getting really quite cross with her. And she was a middle-aged Afro-Caribbean woman. Well, she was African origins from Angola. Had a lot more time with her. She had been infected with a strain of vaccine-derived polio as a child. And so in a very real sense, she had been paralyzed by a vaccine. She thought this not from being vaccinated. The circulating strain itself was originally from the vaccine. So it felt completely reasonable that someone like her would be vaccine hesitant. And there's a lot of circulating vaccine-derived polio in Africa. It's one of the great examples of when vaccines have unexpected effects. I say that, the polio vaccine is still an incredible success story. So it's not like this has paralyzed a huge number of people, but you've got to be sympathetic to people like that.
Yeah, that's interesting. Andreas, did you want to ask anything?
I just wanted to circle back to your journey with the narrative of food. And I wanted to ask you if you would have to give advice to someone who is starting to promote health or health topics, what would have helped you, or what were big obstacles on your way?
I love that question. I think of that through the lens of commercial determinants, in the sense that when I started presenting television, it was for a commercial channel. I was a very young doctor. It was a program where I went around the world and met remote groups of indigenous people and learned their tribal cultures and took hallucinogenic drugs with them. At no point was anyone regulating them. No one was saying the purpose of your broadcasting here is public health, is factual information. At the BBC, it's a little bit different because now almost everything I do is now for the BBC. And so I'm a bit more regulated, but there are things that I could have done to make a lot more money. You can go and speak to people who make far more money out of talking about food and medicine than I have. Have I improved public health? I suppose I could point to some policy solutions, which is what I feel quite proud of and done well, but they've been very small. So the question of how I could have been helped, hard to know what the solution to that is other than just regulate doctors who talk about health on television more tightly. But that is its own form of constraint, where if the government starts getting involved in the regulation of medical communication, I don't think I would have wanted that. So I think I don't have a good answer.
On the back of that question, Chris, can I ask a question? So we saw that doctor coming out and talking about the COVID vaccinations caused the king and Kate to get cancer and all that sort of stuff. And I know that the regulators have started, the GMC have started to take some action. What are your thoughts on the regulators taking action around disinformation?
In that specific case, they're absolutely right. I and some others have been asking the GMC for a long time to maintain a register of conflicts of interest. So in fact, this is my answer to Andreas's question. I wouldn't police very tightly what doctors say on television and radio. The value is that medical experts can go on and give their independent opinion. The thing I would police really tightly is the disclosure and funding of those individuals. The General Medical Council, our regulator, does not keep a register of conflicts of interest. There's nothing mandatory. Throughout my entire career as a broadcaster and doctor, I could be paid by food companies, drug companies, anyone, and you would have no idea. There would be no real way of you declaring it. I'm an academic, so I do declare this stuff. But the opportunities to make money as a communicator are just wild. I mean, you just get paid so much money. So I don't take any money from any health-affecting industries, from pharma, food, formula, health insurance, for anyone. But all of my colleagues who present medicine do. And that, I think, is the thing that the BBC and Channel 4 and everyone should police viciously. If a doctor is talking to you on television about your health, you should know who has paid that doctor how much money. And I don't think those people who do take lots of money, I don't think they should be on air. If you want to make money from a drug company, that's great. But you shouldn't then be on the BBC, in my opinion. Unless there's a drugs company spokesperson, I wouldn't keep back on these people completely. But I think we know that disclosure doesn't mitigate conflicts of interest. So that's what I would police. And I think that's what I wish I had been policed on a little harder. Because I come from privilege, I can say no to the money, and I'm surrounded by colleagues at the World Health Organization and other places I work in who have very clear views on all this.
That's really interesting. It plays to a conversation we've had recently, so that's helpful to understand. Andreas, did you have any other questions? I've just got one more. So we've also been speaking to Tina. She's in Harvard, our group have, and she's talking about, is there a role for, and maybe your last question will probably answer this, but is there a role for health professionals to learn how to be influencers? I was just wondering, when I say that, having heard what you just said, I suspect I know the answer, but just wondering what your thoughts are on that.
So many doctors and nurses and physios have wonderful social media accounts. that stuff is always going to be a soupy mess. Do you know what I mean? My time on social media is very minimal. I do share, clips of the BBC projects I do. I think it doesn't work very well to choose influencers. I think the nature of social media is it has to be organic. You just got to find these weird people doing their crazy stuff and communicating in an effective way. And you then have to regulate the platform and be like, if this person is a doctor and they're communicating about vaccines, you got to know who's paying them. But I don't know how we deal with the problem other than when it reaches the threshold for proper dangerous misinformation. And I'd set that threshold very high. The dilemma that I see in public health is that there are a set of very educated people trying to protect the public in a very sort of sensible way. But it comes across as taking away treaties and fun and generally being rather boring and wanting to tax everyone. And I think that public health needs to work much harder on its narrative. Maybe as an example, the campaign at the moment to ban cigarettes, I think is a huge step in the wrong direction. Banning stuff is almost always bad apart from guns, I think. But you can regulate the hell out of stuff and you can tax it, you can stick warning labels all over it, and you can get to a stage where you cover the externalized costs of the companies that are making it. Public health really struggles with being a boring voice, a lecturing voice, lecturing people, and not kind of meeting people where they are. But there may not be a solution to that. You may need, instead of public health authorities, to lay down a very hard set of advice and then have other forms of communication about how people take it. In my experience, absolutely hate being told what to do. I do, most people do. And I think if you interrogate your own life, when children are told by their parents to do stuff, they just hate it. But the stuff that we come to as individuals on our own, the stuff that we feel we have ownership of, when we ourselves decide to go on the diet, lose the weight, it's very empowering and we feel good about it. But we shouldn't be made to feel that we have a moral duty to do this stuff because we live in a society. I think most people desperately want to be healthy, they want to be fit, they want to look good, they want to be strong and smart. And the role of public health is to create an environment where people feel that it needs them to do. Much more than it is to tell them to do it, it's to create opportunities for them to do it in lots of different ways. The best example is probably that Cancer Research UK campaign. Do you remember that, where they had packs of cigarettes? It was like a cigarette-style pack, and it said obesity is the leading cause of cancer. If people living with obesity need more information that is bad for them, or stopping them losing weight, is the toxic food environment created by some of the food companies that fund Cancer Research UK. So it was just a horrible bit of public health that I think probably led to people gaining weight. So a much better engagement generally with what the ambition of public health is. My ambition is not to reduce anyone's consumption of ultra-processed food. What I want to do is just go, I want healthy food to be affordable and available for everyone. And if you want to eat crap, it should be taxed appropriately. There should be a great big warning label on it, not a cartoon character. And if you then choose to eat the crap and smoke a cigarette and drink the booze, honestly, that's up to you. I sometimes do. My kids sometimes do. Like, that's okay. Food is regulated properly when people have the opportunity to eat healthily. They do. The only reason low-income families eat all the UDF is because they can't afford to eat healthy food. But rich people choose not to eat it broadly. So I think that's the sort of narrative that I try and be really clear about, is I am not telling you what to do. I'm campaigning for a more, the idea is, if your lens is justice and opportunity and choice, if public health messaging is about, we don't care what you do, we just want you to have the freedom to do healthy things, then most people will. I really believe that. There's not very good evidence.
Is there another thing you're going to focus on now, Chris? Are you still going to just keep going towards the food, or is there something else in your sights?
Well, I work with the World Health Organization's Commercial Determinants of Health team, and I think the public get it for tobacco. And this starting to get that food is commerciogenic. What they understand less is that the way our cities are organized for cars is commerciogenic, or air quality is commerciogenic, alcohol, gambling, inaccessibility to sport. There's pesticides, fossil fuels. There's a vast and growing number of industries that really are externalizing their costs at the expense of ecological capital, which is running out, and human capital, which is running out. So this stuff is unaffordable. I do continue to write and publish about, say, specific technical food policy, how you should label a product. But to me, the much more interesting thing is how you get industry out of the room when it comes to writing the policy about how you label the product. So and it's really hard to do this stuff. So, I mean, I'll tell you now, my dilemma is, how do I do all this without sounding like a Marxist? How do I communicate about industry in a way that is nuanced, that doesn't shut down the economy? How do we grapple with these very deep problems? So I have a sort of long-term book about that, but it's a mess. Because I think there are answers, but they require a reckoning with industrial power. The consumer-facing marketing budget of Nestlé is approximately 15 billion Swiss francs, which is the same as pounds per year. And so, to some extent, I can do what I want. That's one company. Nestlé is itself an economy the size of a medium-sized country. That, to me, is the project is going. The thing that determines our quality of life in every respect is corporate incentives. I don't know how we keep the economy afloat and deal with it. And AI is only going to dial up all that inequality. That, I suppose, the heart of the problem. The food is a problem of justice, inequality, and corporate power, and the same is true of tech and everything else. The Food Policy Committee is co-chaired by the Institute for Grocery Distribution, in my opinion.
So we've got turkeys voting for Christmas in policy territory.
It's literally, yeah. If the fox is guarding their geese, the monkeys have been given the key to the banana cage, whatever nice analogy you want to use. It's the police policing the police. It's an emergency, We can't afford the healthcare bill. In Germany, you're a bit behind us, I think, Andreas. But it's coming down the line. Your kids are now getting bigger and bigger. And in France and Italy, there's a sense of it's our rates are lower, and so they will sort of remain the same. So no, we will all become American. The science of ultra-processed food doesn't tell us about the mechanical processing of the food. That's not the interesting bit. The interesting bit of the definition is the purpose of the food, which is to displace traditional food. That's necessarily the project. And so if you care about the recipes and the culture and the health that goes with traditional food, you have to actively protect it from corporate interest. All without sounding like a conspiratorial lunatic. And that's the other thing. You need to talk about the pharmaceutical industry and their price gouging and regulatory failure. But you don't end up saying vaccines don't work. And that's the other dilemma. It's a very narrow space to be rational and reasonable and scientific and not embrace commercial determinants whilst also not selling like a lunatic. I'm going into a tunnel. So if we get cut off, it's been so nice speaking to you, and do follow up on email.
We're really grateful for your time, so we'll let you get on with your morning. You've been very generous already.
Thank you very much.
And it's my takeaway probably is thinking about the reason that people are sceptical and reflecting on that story of the lady who ended up with the polio and not demonizing everyone for their choices.
People aren't stupid. Almost no one is stupid. They're trying to do the best thing in a confusing mess. Do stay in touch, both of you, if I can be any use. I'm so pleased to be asked these questions. Gives me great energy that you are doing all this.
It's amazing. I've made lots of notes. And he said something that really struck me around not demonizing people.
Yes, it's something you also said we were discussing in my line of work. You always have the individual part where you tell someone to lose weight, and you have the generalized part where you say, what is the setting that someone is able to lose weight? And if the healthier choice is always the more expensive choice, the people won't go for it. So I think that's something we should perhaps take into account in our discussion, how to promote healthier choices, or how can we promote leaders to enable more healthier choices. Thank you for setting up this interview. That was really interesting.
He's a superman, isn't he? He's amazing.
When he's talking, I get the feeling that he's burning for his ideas.
Yeah, passionate.
That's always needed as a driver, I think.
Yeah.
And have a nice day.
Thank you.